Hi, my name is Jennifer Pierre. I'm a nurse practitioner student at Maryville University. This is my ID. Okay, and I'm going to be doing the respiratory and cardiac assessment today. We're gonna scan the room first. Okay, thank you. So this is my patient here. I'm going to start off with the respiratory assessment. I'm just going to take a look at the symmetry of the chest, the shape of the chest, looking at the anterior posterior diameter, making sure that it is not longer than the lateral diameter, which it is not. Looking to see if he's using any accessory muscles or any nasal flaring or anything like that, which is fine. He's not doing any of that, which would be, if he was, a sign of respiratory distress. I'm just going to take a look at this trachea, make sure that that is midline, okay, and then the angle of Louis, it's right here, okay, and I'm going to come down that sternum to around the rib area, and then I'm going to look at that costal angle. Okay, and that's the costal angle there. Again, on the chest, I'm feeling for crepitus, which would be like a crunching noise, and we don't want that because that means that there's air in the subcutaneous tissue, and there is no crepitus there. So I'm going to have you turn around that way for me. Okay, the next thing that we're going to do is feel for fremitus, which would be a small vibration on the chest. So every time I touch your back, I'm going to have you say 99.
99. 99, 99, 99, 99, 99.
Okay, and there is a bit of fremitus, which is normal. A decrease in fremitus would be indicative of like emphysema or pleural effusion, or an increase in the fremitus would mean that there's some type of consolidation or fluid in the lungs. So, and there is none of that. So the next thing that I'm going to do is, don't let your shirt up. I'm going to have you lean forward for me, okay? And then I'm going to have you, I'm going to check for diaphragmatic excursion, okay? And I'm going to have you inhale and then hold your breath. Okay, you can breathe normally. Okay, now I'm going to have you exhale and then hold your breath. Okay, good. All right, so for the diaphragmatic excursion, it should be between, let's see, his is actually about 5 centimeters, okay, and it should be between 3 and 5 centimeters, which is normal, okay. And next, I'm going to check for thoracic expansion. You can sit up a little bit, okay, and I'm going to ask you to take some deep breaths, okay, and my thumbs are at that 10th intercostal space. Another deep breath. Good. In and out. Good. Okay. Very, very good. All right, so the next thing we're going to do is percuss the lung area. We're just going to, we're just looking for any areas of dullness. Okay. All right. All right, the next thing I'm going to do is just listen to your lungs, okay? And I'm checking for any crackles or any, take a deep breath. In and out. In and out. Okay. In and out. In and out. Okay. Deep breaths. In and out. Take deep breath in and out. that. I'm just looking for, like I said, any crackles or rhonchi or anything like that. So I'm gonna have you turn around again, okay? And this time I'm gonna have you actually lay on the bed here, okay? And we're just gonna do a quick cardiac assessment, okay? And I'm just gonna take a look at your pull down your eyelids a little bit just to look at your conjunctiva, and it looks nice and clear and translucent. You have a little bit of corneal arcus, which would be indicative of some hyperlipidemia. I don't see any zolesma around your orbits of your eyes. Your mouth is a good color. The pale would be indicative of central cyanosis. You can open your mouth and stick out your tongue for me. Okay, and okay, and the tongue is looking good, the mouth is looking good, no signs of infection or anything like that. You can close your mouth, and the tongue is nice and moist, so there's no signs of dehydration. I'm just looking at the legs and the disbursement of the hair on the legs, making sure that there's no edema or anything like that. There's no hyperpigmentation, which would be a sign of you know, circulatory problems or any cardiac problems, and no edema is present. Okay. The next thing I'm going to do is just feel the, I'm going to actually have you sit up so I can feel the apical impulse. Okay, so I'm going to feel the apical impulse and then the carotid at the same time. Okay, and the reason I'm feeling the carotid is so I can know when the S1 is taking place. Okay, and that is fine. So I'm gonna have you lay back down. Okay, and I'm just gonna feel your pericardium and the apex. Okay, left sternal border and that base. And here I'm just checking for any heaves or anything like that. Okay, so the next thing I'm gonna do is I'm gonna have you sit up on the side of the bed. Okay, and I'm gonna listen to your heart. Okay, first I'm gonna listen to the aortic area. And again, I'm listening for any murmurs, any extra heartbeats or anything like that. The pulmonic area. Chris, you could come around here so that I can see. The second pulmonic area, the tricuspid area, and the fourth intercostal space, and then the fifth intercostal space is the mitral valve area. Okay. All right. So I'm gonna have you turn over on this side, facing me. Okay. Stay on this side, Chris. All right. So I'm going to listen again. The aortic area, the pulmonic area, the second pulmonic area, the fourth intercostal space, the tricuspid area, and then the mitral valve area. Okay. And again, I'm just going to check again for any heaves. Feeling at the apex and the left sternal border and the base, any heaves or lifts or anything like that. If you could sit up at the side of the bed, that would be great. Okay, and again, if you could lean forward for me, and we're gonna check again. I'm just gonna check here just for any heaves or lifts or anything. Come around, Chris. Okay, and that looks good. Okay, so all of that looks good, and that's the end of my cardiac respiratory assessment. Thank you.